Hi, my name is Sophia Varadkar, and I am a consultant paediatric neurologist and deputy medical director at Great Ormond Street Hospital for Children in London in the United Kingdom, and I'm an associate professor at University College London Institute of Child Health. So I have two parts to my job. The first part is I'm a children's doctor, and I look after children and young people who have epilepsy. And my formal title is consultant paediatric neurologist. So I look after children and young people where the drugs haven't worked. And I work with a large multidisciplinary team of neurosurgeons, specialist nurses, psychologists, EEG experts, to name just a few. And together we try to understand, could other medications help, or could we offer non-drug treatments, epilepsy surgery, special stimulators called vagus nerve stimulators, and special diets called the ketogenic diet. And then the second part of my job is called Deputy Medical Director, and that's a medical leadership role. So I work with a team of senior doctors and senior colleagues, helping to keep the hospital running safely and well on a day-to-day basis so that we can offer the best service to our children and young people and their families. So I actually don't have a typical day, and that is something I love. I have no chance to ever get bored. When I'm being a doctor, I see young people and children and their families on the wards, in clinic, sometimes in the intensive care units, and I take part in lots of what we call multidisciplinary team meetings, where everybody gets together and decides and tries to figure out what the best thing forward is for a child or a young person. When I'm on the other side of my job in medical leadership, I have a back-to-back diary with lots of meetings with lots of different people. And the idea of them all is actually figuring out what's the problem, how can we help, how can we fix it? And it's great. Then I do a lot of teaching. I speak at meetings, educational and academic, and I love those. I really look forward to them because they are such an opportunity to get a chance to meet colleagues and share ideas and experience and research, and colleagues from where I work, from around the country and internationally. So I grew up in Dublin, in Ireland, and I went to medical school at Trinity College Dublin. I loved my university days. And my early years of training as a doctor were in Dublin. And then I moved to London with my husband to continue specialist training in paediatrics, children's medicine, and in neurology and epilepsy, which is my specialty, looking after diseases of the brain. And I completed that specialty training in London, and I did a PhD at the UCL Institute of Child Health. And that was in the lab, and I absolutely loved that for the couple of years. And then I took up this job as a consultant paediatric neurologist, and then I developed my leadership skills in a number of different roles, which were called specialty lead, called a chief of service, and now the job that I'm in now. And the other thing I've done along the way I've really enjoyed is being involved with national roles. So the International League Against Epilepsy and the British Paediatric Neurology Association. And for the British Paediatric Neurology Association, I lead on the Paediatric Epilepsy Training Programme, which is a great chance to share teaching, training, information, and to meet lots of different people, which I really, really enjoy. The other thing on my journey is I've managed to have two children who are now teenagers, and now making decisions about what they're going to do with their careers and their lives. And I have a boy and a girl, and I love living in London. So learning to be happy and working in a busy, buzzing city has also been part of my career journey, and keeping a busy social life as well. You know, I did not. And when I was in school, I really didn't know what I wanted to do. And even after I decided to do medicine and got into medical school, the first couple of years, I really wondered, had I made the right choice? And then we started working in the hospitals, and I started talking to patients and their families and working in teams. And that's when I really started to enjoy my job. I'd gone into medicine because of a strong family tradition. My father is a family doctor, and my mother was his practice nurse. I went into medicine because it was a family tradition. My father, who's retired now, was a family doctor and my mother was his practice nurse. And then when I went into the hospitals, I discovered that I really enjoy working with people. I love being in teams. I love having a purpose and a focus. And my job really gave me those things. And after I got used to working in the hospitals and discovered my love of my job and my career, I stopped questioning why I had done this. And that took some time. And I also never second guessed or asked myself, could I do this job because I was a woman? I felt that all of those things I could do, this job lent it to it and allowed me to do it, and the opportunities that it gave me. Careers in medicine are full of real opportunities. You can look after patients, you can get involved in teaching, you can do research, you can get involved in leadership, you can be involved in your local area, in your regional area, nationally and internationally. And careers in medicine allow you phenomenal collaborations. Best advice. I'm going to answer that in two parts because I got really good advice early in my career and I've had different really good advice later in my career. So in my early career, somebody said to me to be polite and nice to everyone. And I really espouse that. And when I was younger, that meant to me making friends and connections, and it made my working life much better. But now, as time has gone on, we've really began to understand something called civility saves lives. When you're polite, when you're nice, when you work with people well, it actually makes healthcare much safer. In the later parts of my career, when I got too busy, took on too many things, had so much going on, I forgot to cut myself some slack. And a lot of people said to me, Sophie, be kind to yourself. And I think that's really good advice for all young women starting out on busy careers. Remember to look after yourself. Remember to factor in some time for you and your family and the people you love. And don't forget that on the way.